The palate is a partition located at the gap between the nasal cavity and oral cavity. Among the palates, the hard palate, which is the one in the front, is very solid because it is part of the maxilla and the palatine bone. The soft palate at the back is soft because it is a muscle. In the past, it was called 경구개 and 연구개. The new medical terms are hard palate and soft palate. These terms are much easier than the ones before, so even children can learn them. This part is the nasopharynx, and it becomes the oropharynx further down. The nasopharynx has become the oropharynx. The front of the oropharynx is the oral cavity, where you can see the tongue and teeth. The tongue, as you can see, is formed by muscles, so you can move it freely. This tooth is stuck in the maxilla. In front of the maxilla is the upper lip. Part of the mandible can also be seen. The muscle attached to the mandible is the masseter. Try touching the masseter that pops out when you bite something. At the rear of the masseter is the parotid gland. Here, we cannot see the passage through which the saliva produced by the parotid gland passes to go into the oral cavity. The food we intake goes through the oral cavity, the pharynx, and then to the esophagus. On this sectioned image, you can see numerous systems: the digestive system, bone system, muscular system, respiratory system, and cardiovascular system. A doctor should acknowledge the positional relationships formed between the systems. For example, the esophagus is located at the front of the thoracic vertebrae and behind the left bronchus. Knowing the position correctly is a must-know to diagnose and treat patients. In reality, doctors and hospitals do not look at sectioned images of a cadaver, and instead, they look at patients' CTs and MRIs. If you look closely, you can see that the esophagus is connected upwards. Food passes the esophagus and goes down into the stomach, and eventually travels to the duodenum. Observe the pancreas. The digestive fluids produced from this organ go to the duodenum. The pancreas is connected to the spleen. The spleen does not fall under the digestive system, but falls under the lymph system. In other words, the spleen eats up the bad substances in blood. This person, or cadaver, was suffering from leukemia, so there were lots of cancer cells in the blood. Therefore, the spleen that consumed these cancer cells got bigger than a normal person's spleen. The digestive fluids produced from the liver are concentrated at the gallbladder and go to the duodenum. The clear distinction between the liver and gallbladder cannot be seen. The liver is covered by the ribs, so you cannot easily touch it. Food passed through the duodenum, jejunum, and ileum, and these in total are called the small intestine. You can see that the diameter of the large intestine is bigger than that of the small intestine. The digestion and absorption of foods and nutrients are done in the small intestine. However, the foods do not stay long in the small intestine, but stay in the large intestine for a longer time. On this sectioned image, you can see that there are food located in the large intestine, but not in the small intestine. The ileum is the ending part of the small intestine, and the cecum is the starting part of the large intestine. On this sectioned image, you can see that the ileum connects to the cecum. In other words, you can see the boundary between the small intestine and large intestine. This is the cecum tail attached to the cecum. The descending colon becomes the sigmoid colon and eventually becomes the rectum. The color blue in the small intestine is air. This person passed away lying down, so light air was driven forward. The sigmoid colon becomes the rectum. There is also food found in the rectum. The rectum is located at the rear of the urinary bladder. The rectum and urinary bladder are surrounded by the hip bones. This is the last part of the large intestine, which is the anal canal. Around the anal canal exists the anal sphincter muscles.